Abortion is on the ballot this November, not just figuratively. People in Michigan will be able to vote on whether it should remain legal. And yesterday, Republican Senator Lindsey Graham introduced a bill that would ban abortions nationwide after 15 weeks. For more on this, Dr. Maya Bass joins me. She is the co-chair of the Committee to Protect Healthcare's Reproductive Freedom Task Force and is also a family physician. Dr. Bass, thanks so much.
Thanks for having me.
First off, tell us what your organization does and how your work has perhaps changed since that Supreme Court ruling.
So the Committee to Protect Healthcare works with healthcare providers, works with attorneys, works with elected officials to really promote strategies for ensuring the freedom of healthcare for people in America. And with the fall of Roe, we had to make sure that we had a task force specifically looking at reproductive freedom and making sure that abortion providers and other physicians, as well as our committee members, were able to come out to talk to media, to work towards getting these issues handled by our elected officials.
Well, speaking of an elected official, let's talk about the plan from Lindsey Graham. If it were to pass, what would it actually do?
So if that passes, then it could make abortion illegal in the majority of the country after 15 weeks, which is not based in any medical expertise or medical science. And really what we need to see this as is the first step into a total abortion ban, because that's what it is. It's the Senate, the senator showing that we can put a federal abortion ban bill into place, and that what we really need is the American people to vote and to make sure in November we are telling these elected officials that that is not what we want as the American people, which is what we've seen when we survey them, that the vast majority of people here do want safe, legal abortion, and that these senators are not acting in their with these constituents in mind. They're definitely not acting with my patients in mind and people's health.
This issue is obviously energizing voters, as you mentioned. We saw it in Kansas. What are you seeing within your work? How much is this motivating people? Because polls are one thing, action is another.
This is really motivating. I work in both education as well as patient care, and we see medical students, residents, we see patients getting involved, getting out the vote. We see them donating to abortion funds. I get asked all the time, how can I help? How can I make sure that we keep this up and available to people? As physicians, we're seeing the outcomes, the patient stories about people not getting the care that they need, people traveling distances, and all of this has really energized physicians and people in the community to fight for the right to have abortion remain legal and accessible.
I would imagine you're hoping for, obviously, a Democrat victory in November, but are you planning for the opposite? Are you planning for a loss and possible national ban on abortion, as we're talking about? What would happen then to your work? How would you respond to it?
Many states are making sure that they have things on the ballot to protect the right to abortion in their state, and that's really crucial. But we're working really hard to make sure that that doesn't happen, that in November, we have elected officials that'll make sure that we do not have federal abortion bans. And so, that's how we're working towards it. Otherwise, we're working within our academies. National medical organizations are all coming out and making statements how this needs to be part of healthcare. And we're making sure that patients know about what they have accessible to them and where they can get healthcare.
Dr. Maya Bass, thank you for taking the time. We appreciate it.
Thank you for having me.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.